Okay, and now I have to introduce you to Dr. Hackett. Okay, so he's great. I love this guy. This guy had done 38 or 39,000 injections of the iliolumbar ligament and the sacrum, okay, before he ever published anything. So essentially what he did, he was an orthopedic surgeon, and he was really cool. He has this book that to me is like my little Bible, that has all his secrets and all his things that he did. And anybody who ever talks about the sacrum is gonna, talk about his research. But I mean, when he wrote his book, he actually did it after 30 years of doing this and observing, which is pretty remarkable. So this is the book, Ligament and Tendon Relaxation, treated by Prolotherapy. So Prolotherapy or Prolozone or Prolo anything is a fancy way to say that you can help treat those ligaments that hold the sacrum together. Okay, and I'll show you a picture because I think that's... So this is a lot of the research that he did. This shows you the pelvis from the back, okay? And what is showing you, you see on the right side is showing you how all the ligaments are and how they interact with each other, okay? And you can imagine, and one of the most important ligaments actually is that one that calls IL, and that goes from the ilium to L4 and to L5, okay? And a lot of the chronic back pain is actually that ligament being too loose. And then when that's too loose and there's too much motion in that area, the facets get all torn, they get all tense and in pain, and people have a lot of L4, 5, symptoms. So what happens is you can use prolotherapy, which is when they were using the high sugar things and they were trying to scar that ligament so it would get really tight and you wouldn't have the hypermobility. Well, later, and that's what he did because in those days that's all people had. Later, this has been evolving in that instead of trying to make a ligament too tight or tight, which is better than nothing, what people are trying to do now is using therapies such as like Prolozone or PRP. Prolozone essentially is putting ozone into those ligaments with B12 tramil and some other, alternative medications. And what you're trying to do is you're actually trying to regenerate that ligament. You want the ligament to be able to have a little bit of motion and proprioception. You don't want to just have something that is tight. You want to have something that has that ability of micromanaging. Sometimes it has to be a little looser, sometimes it has to be a little tighter. So any of the therapies that are going to rejuvenate or reactivate or regenerate that ligament is going to work better than the therapy that is just going to scar it down.